Hi, Chris here at Take 5 with a Physio, and today we're talking about talking, communication, and about the words that physios use when they're communicating with patients. Now, there's some great evidence from New Zealand in 2013 which shows that patients get information from a number of sources, including their friends and their family, but the most important one, and the one that's going to influence their beliefs and their attitudes the most, is their healthcare professional. Which means if we're using words haphazardly, then actually what we can do is induce fear, anxiety, and really have an influence on the protective responses that that person demonstrates. Other evidence suggests that certain words can have a huge influence on the processing of language in the brain. Certain words like excruciating and severe activate areas of the brain called the pain matrix, the areas that are activated when we are suffering from pain. Other words that you wouldn't deem appropriate or relevant, words like mouldy and smelling, these words actually have an influence negatively on the brain too. So we have to be really careful with the words that we're using and the language we're using with our patients. Now, here at Guy's and St Thomas's, the gym team, run by my colleague Dan, they're doing a fantastic project. Now, what they're doing is they are taking commonly utilised words in the osteoarthritis guidelines created by NICE. And this is the basis of an education session that they have with people who come in with knee arthritis. Now, they're wary that some of the words that they use, words like osteoarthritis and degeneration, things that we take for granted as appropriate, they're aware that they may have a negative impact on their patients. So what they're going to do is they're going to display words in a questionnaire to their patients, and they're going to see whether or not it influences scores of their discrete emotions, whether or not they relate certain words and rate highly on Likert scales for measures of anxiety and fear and even disgust. And when they collect that data, they will bring patients into a focus group and they'll discuss. They'll find out what these words mean to the patients, and whether or not the words that they do use and the words that they do take for granted have a negative impact.
Mrs. Jones is a 78-year-old who went to her doctor about her achy back. The doctor read the radiology report and agreed that it did look a bit crumbly, but that he would refer to a physio to keep her on her feet and keep her out of a wheelchair. She saw someone at the hospital who showed her the x-rays and said she had degenerative disc disease. They spent some time explaining that the diagnosis was essentially arthritis and nothing to worry about. Her daughter helped her look up the diagnosis, as the idea of her back degenerating did concern her. She'd been told before that she had arthritis in her knees, and she imagined that it'd be exactly the same as her back. And everywhere she looked, there were these pictures that looked painful, excruciating. She couldn't imagine that maybe her back could look like that on the inside. It was a scary thought.
Now, as you can see, words do have a huge influence and are often misconstrued. So as clinicians, we have to be very wary of the words that we're using and explain and contextualise any words that we do use in the best possible way for the patient. Thank you for listening. If you have any comments, feel free to send me a message. If you see this on YouTube, please press the like button and please share. And I'll see you next time we take 5 with a physio.